So ProCare Health was the first to come out with a multivitamin for SADI patients. But now we've gone and upset the apple cart. We've reformulated this product. And why, you ask? Well, in terms of bariatrics, it's actually a really young field. The first bariatric surgery was only performed in the 1950s, and the first duodenal switch was actually performed in 1986, and the first SADI only in 2007. So this is a product we're going to continue to reformulate over the next coming years as we continue to learn more about the nutritional needs of the SADI patients and the duodenal switch patients. So you ask, what are the changes? But first, before we get into that, let's talk a little bit about the SADI and the duodenal switch. These are two very different procedures, although sometimes we choose to supplement them in the same way. When it comes to these procedures, there are multiple ways that they can be performed by different surgeons. So when we're talking about this, we're going to talk about limb length, which just means the amount of intestine that's left to absorb your nutrients. In general, the duodenal switch has far less limb length compared to the SADI, but also the way a surgeon measures limb length can be very different too. So we can have two patients that in the op note, it states that there's 150 or 200 centimeters of common channel limb length, but they can actually have two very different limb lengths when someone else measures it that's the same person. And what this boils down to is that these two patients, while in the op notes it says that they have the exact same limb length, actually have two very different nutritional needs. So because of this variation in the surgical technique, what we've done as a supplement company is try to create a supplement line for these two procedures where your healthcare provider can work with you to choose a supplement regimen that works for you and your medical history. So for this newly formulated product line, every patient that's had a SADI or a duodenal switch is going to take our newly formulated SADI Core Multivitamin. And then for those patients that have additional nutritional needs, they're going to work with their healthcare provider to take our SADI ADEK Plus. So not everyone is going to need the plus, and you'll work with your healthcare provider to determine what's the right regimen for you. Both of these products are a once daily formulation, and they can be taken together or separate. Some of the changes you'll notice in our SADI Core Multivitamin, we changed the form of vitamin A to primarily be the preformed vitamin A to increase absorption. We also increased vitamin D from 100 micrograms to 125 micrograms or 5,000 IUs. And we added an additional 125 micrograms in the SADI ADEK Plus product. Additionally, we changed the form of vitamin K to a blend of K1 and K2, utilizing both MK4 and MK7 for K2, which both of these play an important role in bone health. And we added an additional 250 micrograms to our SADI ADEK Plus product. We added an additional 30 milligrams of vitamin E in our SADI ADEK Plus product. We also lowered vitamin B6 in our Core Multivitamin. When it comes to supplementation, it's important to balance reducing the risk of deficiencies, but also reducing the risk of toxicities. And this is a nutrient that we felt we could optimize by lowering the level of this nutrient. In the Core Multivitamin, we increased folate to 1,000 micrograms of dietary folate equivalents to match the ASMBS guidelines. We also decreased vitamin B12 to 500 micrograms due to the reported high levels of B12 that many of our programs are sharing with us. We also changed the form to 100% methylcobalamin to maximize absorption. We included 100 milligrams of magnesium citrate in our SADI ADEK Plus product, making it 200 milligrams per day total, and a 50-50 blend of citrate and oxide, maximizing absorption and creating space for both of these nutrients. We changed the form of zinc to zinc citrate, which tends to be tolerated better and also have a less bitter taste when compared to zinc oxide. And we added 15 milligrams of zinc to our SADI ADEK Plus product. And we changed the form of copper to copper glycinate due to the benefits of chelating this nutrient. Chelating it means we attached it to the smallest amino acid possible, and that provides optimal absorption and increases bioavailability. And then we added an additional 1.5 milligrams to the SADI ADEK Plus product to ensure that we stay within that proper zinc to copper ratio. This SADI Core Multivitamin still provides 60 milligrams of iron in that once daily dosage. So in this new DS SADI formulation, we increased a few of the nutrients, including vitamin D, E, K, folate, magnesium, zinc, and copper. We felt that these nutrients needed to be increased to optimize nutrition levels and decrease the risk of nutritional deficiencies. Alternatively, we lowered the levels of two nutrients, vitamin B6 and vitamin B12. When it comes to supplementation, it's just as important to optimize the level of nutrition to reduce the risk of nutritional deficiencies, but also reduce the risk of nutritional toxicities. We had heard from several of our programs that many patients' lab levels were coming back high when it comes to these two nutrients. So we took this opportunity in this reformulation to lower the levels of these two nutrients. We also took this opportunity to change the forms of vitamin A, K, zinc, and copper. We took some of the latest evidence out there and changed the form of these nutrients in order to maximize bioavailability and increase absorption of these key nutrients. With our new DS SADI Core Multivitamin formulation and ADEK Plus formulation, we created both of these products in a chewable once daily. We listened, we heard you. Many of our healthcare providers recommend that patients start with a chewable product right out of surgery. Now we're going to have both, a chewable and a capsule. So depending upon the recommendations from your healthcare provider and your personal preference, you can now choose what's right for you.